Good day, everyone. I'm by name Jasper Joel from Taraba State University, Faculty of Health Science, Department of Public Health, 300 level, representing Group 4 for the seminar presentation on the topic Sexually Transmitted Diseases. At the course of this lecture, we'll be looking at first the introduction, the types and symptoms of sexually transmitted diseases, the risk factors, effects of sexually transmitted diseases, prevention of sexually transmitted diseases, common antibiotics used to cure sexually transmitted diseases, and the treatment of sexually transmitted diseases. Introduction. Globally, it is known that every population is exposed to one disease or the other, but can be managed, prevented, or controlled if the appropriate health practices are applied to them. And this is what half of the world's population lacks. Diseases can occur due to lack of knowledge, lack of awareness, or self-discipline. Sexually transmitted diseases is one of the fast-growing health cases globally. Sexually transmitted disease, as the word implies, is a group of diseases that can be gotten through sexual intercourse. This can either be through vaginal, oral, and anal sex, but are mostly gotten through vaginal sex. These disease conditions are likely to lead to long-term health consequences that are mainly irreversible or life-threatening. They are gotten or caused by bacteria, fungi, viruses, yeast, and algae, and can be transmitted when present in semen, blood, vaginal discharge, sweat, and the use of inanimate objects such as needles. Types and symptoms of sexually transmitted diseases. There are many types of sexually transmitted diseases, but at the course of this lecture, we'll be talking of only 6. We have HIV and AIDS, chlamydia, human papillomavirus, that's the HPV, genital herpes, gonorrhea, and syphilis. HIV and AIDS. AIDS is caused by the human immunodeficiency virus, HIV, which is spread through unprotected sexual intercourse with an infected person or by using a contaminated needle to inject drugs. AIDS simply means acquired immunodeficiency syndrome. HIV can also be spread through intravenous drug use and much less commonly, blood products, needles, or other sharp instruments contaminated with infected body fluids or blood. Opportunistic illnesses pose minimal threat when the immune system is functioning properly. However, when the body's defenses are down, as in AIDS, they seize the opportunity to create havoc. There are different types of medications available for the control of HIV. HIV remains incurable. Good adherence to medication can allow those infected to lead long, productive lives and never develop AIDS. People infected with HIV and AIDS tend to experience some of these symptoms. We have headache, difficulty in swallowing, fever, night sweat, fatigue or weakness, loss of appetite, weight loss, chronic diarrhea, nausea or vomiting, itchy rashy skin lesions, chronic coughing, confusion or delirium, and difficulty in breathing. The next disease we'll be talking about is the chlamydia. Chlamydia is a bacterial disease. It can infect the urethra, that's the bladder opening, and the cervix, which is the uterus opening. Many people with chlamydia have no noticeable symptoms. It is common in youngsters aged 15 to 19. The disease is easily treated, but like other sexually transmitted diseases, chlamydia tends to be silent and therefore goes undiagnosed until it becomes more serious than in its early stage. Sometimes, in ladies, it progresses to pelvic inflammatory diseases, PID, which is a major cause of female infertility and pelvic pain. Symptoms of chlamydia in men include penile discharge, mild pain when urinating, then progression to epididymitis. While in women, it leads to abnormal vaginal discharge, mild pain when urinating, progression to pelvic inflammatory disease. Next, we'll be looking at the human papillomavirus, which is the HPV. Scientists have identified more than 100 types of this virus. A number of them are passed from one person to another during unprotected sex and cause benign genital warts, just as seen on the screen. Other human papillomaviruses are responsible for 4 in 5 cases of cervical cancer, in addition to several other genital malignancies. Human papillomavirus is another often silent sexually transmitted disease. According to the National Institute of AIDS and Infectious Diseases, almost half the women harboring the virus exhibit no symptoms at all. Genital warts typically appear in clusters inside and outside the vagina, the cervix, and/or the anus. Male venereal warts, which are far less common, form on the penis, the scrotum, and/or around the anus. It can be contracted through intimate skin-to-skin or sexual contact. There is no treatment for human papillomavirus. However, human papillomavirus infections often clear up on their own. Symptoms of HPV in men include clusters of tiny warts found in the penis, scrotum, or anus, while in women, you find clusters of tiny warts outside and inside the vagina, on the cervix, or around the anus. Next, we'll be looking at genital herpes. Herpes is a shortened name for the herpes simplex virus. There are 2 main strains of the virus, herpes simplex virus 1 and herpes simplex virus 2. Both can be transmitted sexually. It is a very common sexually transmitted disease. Herpes simplex virus 1 causes cold sores around the outside of the mouth, or blisters on the gums or in the throat. However, herpes simplex virus 1 sometimes infects the genital anal area, and it can be transmitted to the mouth via oral sex. Herpes simplex virus 2, on the other hand, usually occurs on or around the vagina, the penis, the anus, or on the buttocks and thighs. Genital herpes is a chronic, lifelong condition. Most of the time, herpes simplex virus lies dormant, but it is reactivated periodically and produces sores. At least half the time of infection, active herpes produces no symptoms at all. So the virus can easily be transmitted sexually without either partner being aware that the carrier has active disease. It cannot be cured, but it can be managed. Symptoms of the genital herpes include itching or burning sensation in the genitals or anus, pain in the genitals, buttocks, legs, vaginal discharge, feeling of pressure in the abdomen, tiny red bumps involving the vagina, cervix, penis, and/or anal area, fever, headache, muscle ache, painful or difficult urination, swollen glands in the groin. The next infection we'll be talking about is the gonorrhea. It is also known as the clap, as you can see on the screen. Chlamydia infection is sometimes confused with gonorrhea, another bacterial infection transmitted through vaginal and anal intercourse and oral sex. Not only do they share many of the same symptoms, the 2 diseases can occur together. Gonorrhea usually begins in the urethra or cervix. However, the bacterium can migrate to the uterus and the fallopian tubes, giving rise to the pelvic inflammatory disease (PID). The infection, like chlamydia, may also involve the rectum. It is possible for a mother to pass gonorrhea to a newborn during childbirth. When that happens, gonorrhea can cause serious health problems in the baby. Alright, so we'll be talking of the symptoms of gonorrhea. In men, penile discharge, mild to severe burning sensation, and progression to epididymitis. That's an inflammation of the tube-like structure that stores and transports the sperm. While in women, we have painful burning sensation when urinating and/or yellow or bloody vaginal discharge, abdominal pain, bleeding between menstrual periods, vomiting, fever, progression to pelvic inflammatory diseases. That's the PID. The next disease we'll be looking at is the syphilis. On the screen you can see the picture of the syphilis bacteria. It is another bacterial infection. It often goes unnoticed in its early stages. Physicians divide the course of the disease into 3 stages. We have the primary stage, secondary stage, and the tertiary stage. The first evidence of syphilis is a hard, round, open sore known as the chancre in the genital area. Young women often don't realize that they are infected because the initial chancre typically may develop inside the vagina, whereas with boys, It forms on the outside of the penis and is noticed immediately. Since syphilis chancres aren't painful and typically heal within 4 to 6 weeks, most boys don't see a doctor. A pregnant woman with primary or secondary syphilis transmits the bacterium to her fetus, which might lead to death of the fetus or abortion. Infection later in pregnancy leads to many problems, including anemia. Symptoms of syphilis: painless chancre on the penis, vulva, vagina, and cervix or around the mouth. Inflamed lymph nodes, sores in or around the genitals or anus. Mild fever, fatigue, headache, and sore throat. The risk factors of sexually transmitted diseases. First, we have unprotected sex. Vaginal or anal penetration by an infected partner who isn't wearing a latex condom significantly increase the risk of contacting sexually transmitted diseases. This doesn't mean that when you use condoms, you won't be at risk of the disease. It's just that it reduces the risk. Even if it is at 100%, it reduces it by 50%. So there is still a possibility of getting contacted because there might be a hole in the latex condom which you might not be aware of. Then we have improper or inconsistent use of condoms. It can also increase the risk of contacting the disease. Having a history of STD, that's having one sexually transmitted disease, makes it much easier for another sexually transmitted infection to take hold. Effects of sexually transmitted diseases. There is no overstating the importance of being tested and treated for sexually transmitted diseases because they can be easily passed from one person to another. If left untreated, sexually transmitted diseases can lead to a serious long-term effects. Some of these long-term effects include male and female sterility, that's male and female infertility, the ability of both sexes not to reproduce if being infected with sexually transmitted diseases and left untreated. We have the damage to major organs such as the heart, the kidneys, the brains, etc. We have the pelvic inflammatory disease, which is a damage, like it causes damage in ladies because it leads to infertility also. The fallopian tube will close and you won't be able to reproduce. It also leads to pelvic pain and infertility. Tubal pregnancy. The fetus grows in the fallopian tube instead of the womb. That's when you get contacted with sexually transmitted diseases. We have cervical cancer. Most of these cases of cancer is due to sexually transmitted diseases, sharing of sharp objects that are already contaminated. Then we have pain during urination or intercourse. When you find out that when you go to urinate, there is this mild pain you always feel. You have to visit a doctor for a medical checkup. Or maybe when you are having sex with your partner, and you feel that pain, you have to visit any physician for your medical checkups. Then we have birth defects, that's including mental retardation of a baby. Men and women with sexually transmitted diseases experience frustration, anxiety, fear of rejection, isolation, guilt, embarrassment, shame, and feelings of physical guilt or contamination. That's psychological effects. You find out that most of them don't want to associate with others. They feel left alone. They are always scared of rejection. They always isolate themselves from other people. There is this guilt they always feel. They always feel embarrassed.
After 3 months, regular.
Prevention of sexually transmitted diseases. There are several ways to avoid or reduce the risk of sexually transmitted diseases. The first is abstinence. Abstaining from early sex or unprotected sex is the most reliable way to avoid or prevent infection. Then we have 2. Staying with one uninfected partner. Another reliable way of avoiding sexually transmitted diseases is to stay in a long-term mutual monogamous relationship in which both parties have sex only with each other and neither of the partners is infected. Thus, both partners have to get themselves tested before they go into that relationship. 3. Don't drink alcohol excessively or use drugs. It is difficult to make responsible choices about your sex life and practicing safe sex if you are impaired by drugs or alcohol. When under the influence, a person is more likely to have sex with someone they may not pick if they were sober. You find yourself doing things you don't want to do when you are drunk. So one of the best ways is to stay away from alcohol and hard drugs. When we're talking of hard drugs, there are some of these drugs that are injected into the body, and the injection might be contaminated. Then 4. Use condoms and dental dams consistently and correctly. Use a new latex condom or dental dam for each sex act, whether oral, vaginal, or anal sex. In Never use in oil-based lubricants such as petroleum jelly with a latex condom or dental dam. Condoms made from natural membranes are not recommended because they are not as effective at preventing sexually transmitted diseases. Note that while condoms reduce your risk of exposure to most sexually transmitted diseases, they provide less protection for sexually transmitted infections involving exposed genital sores such as the human papillomavirus or herpes. Then 5. Communicate. Before any serious sexual contact, communicate with your partner about practicing safe sex. Be sure you spatially agree on what activities will and won't be okay. Consider pre-exposure prophylaxis. That's number 6. In short, we call it PrEP. The Food and Drug Administration, that's the FDA, has approved the use of the combination drugs to reduce the risk of sexually transmitted diseases such as HIV in people who are at very high risk. Then get vaccinated. Getting vaccinated early before sexual exposure is also effective in preventing certain types of sexually transmitted diseases. Vaccines are available to prevent human papillomavirus, hepatitis A, and hepatitis B. 8. Consider male circumcision. Male circumcision can help reduce a man's risk of acquiring HIV from a woman who is infected, heterosexual transmission, by as much as 60%. Male circumcision may also help prevent transmission of genital human papillomavirus and genital herpes. Then 9. Vaccine. Human papillomavirus can be treated or prevented using vaccine infection. Then medication and practicing safe sex to avoid the spread of the disease to others. Control of sexually transmitted diseases. There are several ways to control the spread of sexually transmitted diseases, but these are the few we are going to be looking at the course of these lectures. First, it is important to have an open and honest conversation with your partner. 2. Correct and consistent use if the male and female latex condoms is highly effective every time you have anal, vaginal, or oral sex. 3. If you have latex allergies, synthetic non-latex condom can be used. 4. Talk openly about sexually transmitted diseases. 5. Avoid sexual contact with anyone showing signs and symptoms of sexually transmitted diseases. 6. Be screened and get tested regularly. 7. Practice mutual monogamy if you are sexually active. 8. Avoid alcohol and recreational drug use. Common antibiotics used to cure sexually transmitted diseases. There are many antibiotics actually that are used to cure some sexually transmitted diseases. But here are a few from those. Here are a few we pick from the many we have. First, we have the Zithromax, azithromycin, vibramycin, doxycycline, which are used to cure chlamydia. Then we have penicillin, which is used to cure syphilis. Then rocephin or ceftriaxone for curing gonorrhea. The last thing we'll be talking about at the course of this lecture is the treatment of sexually transmitted diseases. The few ways we can treat sexually transmitted diseases are: 1. Antibiotics. Antibiotics, often in a single dose, can cure many sexually transmitted bacterial and parasitic infections, including gonorrhea, syphilis, chlamydia, and trichomoniasis. Typically, you will be treated for gonorrhea and chlamydia at the same time because the two infections often appear together, as I earlier said. Once you start antibiotic treatment, it's necessary to follow up if you don't think you will be able to take medication as prescribed. In addition, it's important to abstain from sex until 7 days after you have completed antibiotic treatment and any sores have healed. Then, antiviral drugs. If you have herpes or HIV, you will be prescribed an antiretroviral drug. You will have fewer herpes recurrences if you take daily suppressive therapy with a prescription antiviral drug. The sooner you start treatment, the more effective it is. Azithromycin, in a single oral 1 gram dose, is now a recommended regimen for the treatment of non-gonococcal urethritis. Highly effective single-dose oral therapies are now available for most common curable sexually transmitted diseases such as syphilis, gonorrhea, chlamydia, and trichomoniasis. Yogurt can be used in treatment of yeast infections. Thank you very much for your time, and thank you for listening. Please do well to like and comment in the comments box below.